Heard at Health is sponsored video content brought to you by MedCity News.
Hi, I'm here with Yusuf from Zelis. Thank you so much for taking the time.
Thanks for having me.
Yeah, so we'll just jump right in. To start, when it comes to the healthcare financial system, what are some of the biggest challenges you're seeing for payers and providers?
Well, today, there's roughly $2 trillion that flow through our U.S. healthcare system every year. And there is still a significant portion of that that's manual and very paper-based. And that's due to a lot of lack of legacy systems, outdated systems, and a patchwork of systems that are all involved in this process. And so today, we at Zelis, we're trying to simplify that overall and bring the experience and unify it across the board.
Yeah, well said. So going off of that, what are some ways that Zelis is trying to solve for those challenges?
So first, we're trying to bring a lot of technology that was built from the ground up with deep healthcare expertise to mind. In addition to that, we're trying to really unify and bring together both our payers and providers. And so today, Zelis processes over $285 billion in payments on behalf of 750 payers and 850,000 providers. So we've been very fortunate to kind of bring scaled assets to the table and help streamline and unify the overall payment experience.
Yeah, really interesting. So, looking ahead in the next 5 or so years, what are some trends that you think will really guide or transform this space?
Well, I don't know if this is going to sound so trendy, but I think nirvana would be fast and effortless payments that can make sense and truly be reconciled from day one, and kind of bringing trust back into the system so both payers and providers don't have to do things on their own, and they're really kind of sharing the same data language and speaking the same data and dollar language to be able to do their job. And so at the end of the day, when you can make sense of payments, not novel, when you can understand them and trust them and not have to go through a myriad of fixes over time, that is literally the future of healthcare.